I'm Rachel Polito, and I'm a physical therapist here at PTS in Dyersville. And today we're going to talk a little bit about knee replacements. So this is a very common surgery that people have done. Usually it's done for when you have severe arthritis in your knee that basically nothing else can be done for except to get a new joint put in. So the numbers on this surgery are kind of interesting. So there's over 650,000 of them done in America every year. So it's very, very common. And I was actually kind of interested to see if it was more men or women that have it done. And actually it's 63% women who have the surgery done and 37% men who have it done. So it's a little bit more common in women versus men. And then the other thing that people always seem to ask is, how long does a knee replacement last? So now, today, they last a little bit longer than they used to, and actually 80% of knee replacements will last over 20 years. So they have a pretty good lifespan. So it's definitely a common surgery. There are obviously risks, like with any surgery, but it's pretty safe, commonly done procedure, and we see it a lot in the clinic. Both before surgery to get you strong before you have it done, and then definitely after surgery to gain your flexibility and your strength back after you have it done. So what we're going to talk about is just 3 different types of knee replacement surgeries that are out there, just to give you a little bit more information. So just a normal traditional knee replacement is going to involve a couple different things. So what they do, this is your knee, so this is your thigh bone or your femur, and this is your tibia or your shin bone. And then the only thing that's not shown here is you also have a kneecap called a patella right here in the front, but that's just not on this model here. So what they do in this surgery, because typically people with really bad arthritis, I'm sure you've heard of like bone-on-bone arthritis. Basically what that means is that the bone on the end of your femur and the bone on the top of your tibia are both pretty much worn through all the cartilage, and there isn't a lot of cushion to protect the joint anymore. So what they do on both of those bones is they go in and they basically shave off the end of your femur bone, and then they put a new surface on to that bone, and that's cemented on, so it's very secure. And then they basically do the same thing with the tibia. So they take a saw, they cut off the top part of your tibia bone, and they put a new surface on that bone. And then there's a little plastic spacer, which in a normal knee, this would be like your meniscus or your cartilage. There's a little bit of a spacer in there. So that's pretty much what a knee replacement would look like if you took an x-ray of somebody that had one. It basically gives you a whole new joint surface in there so that those bones aren't rubbing on each other. More recently, there are some people out there who will do a partial knee replacement, if you've heard of that. So that would be if, let's say, maybe you only had arthritis on the inside of your knee and the outside of your knee looked fine. They might opt to do a partial knee replacement, where basically this whole procedure is done the same, but it's only going to be on the inside or the outside half of it. So then the other half would be your normal regular knee. They wouldn't do anything to that side. So there's some people that think that, you know, maybe the recovery is a little bit easier after that because you've only done half of the surgery that you would with a total knee replacement. But it's still, the recovery is still about the same. There's not a huge difference in terms of length of time before you're kind of back to normal, but it's definitely an option that's out there. The third option is a newer option. It's called a 3D knee replacement. And what they do for that is they would take an MRI or a CT scan of your knee, and then these components that are the new parts that they're going to put in your knee, they use a 3D printer, and they basically make you your own components that are specifically designed based off of your MRI or your CT scan. So the advantage to that is that normally these are just kind of an off-the-shelf product, and they just, in the surgery, they try different fits and they find the one that fits you the best, versus in a 3D knee, these are kind of made specifically for you. So that's just a different option that's out there. I hope you learned something about knee replacements today. If you have any questions, you can give us a call at our Dyersville or Manchester clinics, or you can visit our website. And thanks for watching.